This episode of That Podcast in Hutch is brought to you by me. If you'd like to learn about how you can sponsor future episodes of That Podcast in Hutch, please reach out to me at thatguyinhutch@gmail.com or through my social media channels, which are also That Guy in Hutch. Thank you. Hey everyone, it's That Guy in Hutch, and you're listening to That Podcast in Hutch. This week I brought in a friend of mine who works for Kansas Appleseed. Her name's Haley Kottler, and she's the campaign director and works on anti-hunger programs for the organization. She's done this work for a number of years, and she is steeped in the knowledge of food policy and hunger in the state. And she works a lot on the SNAP program, which is the Supplemental Nutrition Assistance Program, and commonly, or what used to be known as food stamps. One of the things that we talk about in this program is that there were significant changes made 10 years ago in the Kansas legislature under a bill that was called the HOPE Act. And this year, 2025, marks 10 years since that bill came into effect. That bill addressed a number of changes to social safety net programs in the state, but one of them that it really focused on was SNAP benefits. And over time, we've seen a number of other efforts to kind of come in and make significant changes to that. This year, there was some movement to ban certain foods from the program. There was also an effort to make it auditing easier, things like that. So I wanted to talk with Haley, and she wanted to talk about, what we've seen in the last 10 years, but also to kind of like demystify and knock down some of the myths about who's using SNAP, how much fraud is in the program, things like that. So I think listening to Haley, who has this like really deep understanding of the policy and from at the national level and at the state level, I think you'll begin to get a sense of who these programs help and what service they provide for our community. Because under it all, what we're really talking about is making sure that families have the resources they need to not fall further behind. And that's a point that Haley makes really strongly in this episode. And so I think if you listen to this with an open mind, you'll hear a lot of new information about, and you'll learn a lot about SNAP, and maybe walk away with a different understanding about who the program is for, why we have it in the first place. One thing that struck me particularly interesting was that it has such strong Kansas ties. Largely, Senator Bob Dole was responsible for creating the SNAP program and maintaining it over the years. So there's a lot of Kansas history tied into this. And I think you'll enjoy hearing that, and I think you'll appreciate hearing the history of this program and who it helps and how good it is for our state. I have with me today Haley Kottler, who's the anti-hunger campaign director for Kansas Appleseed. And we've been talking and going back and forth a little bit the last couple of months because we're coming up on an anniversary. Well, actually, April was the anniversary, 10-year anniversary of what is known as the HOPE Act in Kansas. And this put in some restrictions, some severe restrictions on access to assistance programs, particularly SNAP benefits or what used to be known as food stamps. And so there was a comprehensive report done that looked at the history of this and kind of the effect that it's had on Kansas. But also I think it's interesting to go back and look at the history of this. So Haley, thanks for coming in and talking me through this today.
Sure. I'm so happy to be here.
Yeah. So let's go back. I read through the report, and one thing that surprised me was that the food stamp program actually started way before I realized. Can you kind of walk us through the history of food assistance?
Sure. So food assistance has had many different iterations in the United States, but it started in the early to mid 1900s as an actual food stamp program where people would buy the stamps and then be able to buy discounted foods like milk or cheese, things like that. From there, it had a number of different ways of going about. So there were some that were pilot programs in certain parts of the country. Those often excluded a lot of rural areas, unfortunately. So we know that our neighbors here in Kansas didn't experience those iterations. And then from there, it really took new forms, probably in the 1960s to 1970s, when one of our Kansas forefathers, Bob Dole, and Jim McGovern in Massachusetts really saw hunger being a huge issue in America, and they took action to make the program into more of what it looks like today, where people can get grocery assistance to buy what they need rather than it just being like a card with stamps on it.
So it was interesting. The original version, like the 1930s version of food stamps, was you'd buy certain groceries, but it was like an orange stamp, blue stamp thing, right? And the one stamp was partly designed not just to offset hunger, but to support farmers getting rid of surplus food. Is that right?
It was, yes. So I thank you for bringing that up because I love to talk about it. We have seen similar programs even recently to help farmers too with like food bank programs, TFAP and others. And so it's just very interesting to me that so much of what happened 80 years ago, we're still doing today.
Yeah. So a lot of those things really, there's a through line on all this.
Yeah.
But in the 1960s, like around 1964, there started to be a bigger national conversation. And this is where Kansas and Bob Dole really enter the conversation. Is that right?
Yep.
Okay.
Yep.
Tell us a little bit about the changes in the 1960s and what sort of social dynamics happened there to move us to the more modern version of food stamps.
Sure. So in 1964, a Food Stamp Act was passed, and this really reformed the program in a lot of ways, but it allowed for more pilots across the nation that would, in fact, give that grocery assistance rather than just the blue and orange stamp cards.
Did it allow states to experiment a little bit and try their own programs?
It did allow a little bit of experimentation, but not enough that it made a big difference, I would say. And then after that, in 1968, CBS did a documentary on nightly news. It was a special called Hunger in America. And this looked at, of course, hunger in America and what poverty looked like. People were shocked because there were places like Appalachia, San Antonio, and others where they showed what people were really dealing with around food and resources in America. It's very graphic. I encourage everyone to watch it because it really does set the tone for what we're up against when we talk about poverty and hunger. I was very shocked even watching it several months ago. An infant dies on television for the whole world. Whole world is watching this due to starvation. The doctors are talking about how this child is malnourished by no fault of the family, right? They did not have food. It's also very interesting because they interview lawmakers, both federal lawmakers and local lawmakers, and the same talking points against safety net programs were existing in 1968. The same myths about people were really existing still then. So it really is a very interesting parallel to what we deal with now on SNAP and talking about hunger in America.
So that documentary really kind of sprung things into action a little bit because did people not realize, and then the world was different. Then we have to take a step back maybe and realize that we didn't live in like the Twitterverse or anything like that. So seeing that like television news was how most people got their information. But people before that really didn't know outside of their local communities what was happening, did they?
I'm not totally sure, but I think that it being on TV and being right there in people's faces was pretty jarring. Even now, when we think about hunger, people think of other places outside of America. And so to see fellow Americans on this screen who are, working all day, who have families and are still starving, I think was a jolt to the American public.
Yeah. You talked about some of the myths and some of the talking points against social safety net programs. They existed in the 1960s, and we have that conversation again today. I mean, a lot of it's the same. What are some of the myths surrounding public assistance and in particular SNAP?
Sure. I think the biggest would be that people who can't afford food just are lazy or not working, which just fundamentally isn't true. We constantly hear this quote unquote, pull yourself up by the bootstraps mentality. Well, what do we do when people don't even have bootstraps or shoestrings to tie their boots with, right? That was actually in this documentary. There was a lawmaker talking about how, folks who are in poverty should just work harder. Yeah. I hear that in the State House. Basically every day I'm up there, right? That folks who need to be on Supplemental Nutrition Assistance Program or families who need school meals just need to work a little harder. Well, the reality is these families are working as hard as they can, and ends still aren't being met. I
want to pause a little bit on this. What do you think causes that disconnect between how is it that people, I mean, I have some theories, but I'll want to hear what you have to say. How is it that people who are tasked with setting policy and understanding their environment to make policy that works for people, how are they so disconnected from the experiences of people who need the help?
It's a great question that I wish that I could answer, and I genuinely don't know. I'd love to hear what you have to say. I will say it's a tough environment for me because I feel that lawmakers say that they understand, right? A couple years ago, I was in an office of a state senator, and we talked about, I was with a colleague who talked about during the pandemic that she utilized food boxes to get by. And this lawmaker grabbed her hand, and they sat there emotional and cried together about how both of them had experienced, the lawmaker had experienced food insecurity in college and talked about what that faced, and it was heart-wrenching. Yeah. But they sat there together and held hands, and there were tears on every side, right? And 3 weeks later, this lawmaker voted to increase work requirements on SNAP. So I don't actually know what that answer is because you were a former lawmaker. Lawmakers are in their community and seeing this. I know that they're seeing what our food pantries and our food banks are doing. I don't know how we get to a point where everyone sees what hunger and hardship really look like in the community.
It feels like it's easy to let a false narrative take hold because there's a lot of chatter out there. But unless you see it and actually hear the experiences of people, you don't know. You don't have to know. And that I think is one of the things that creates that kind of disconnect. But let's talk about that a little bit. Like the report also talks about like the amount that people get per month, the average amount, what that amounts to per meal per person. It also talked about how the fraud rate is actually much lower. Talked about the minimum wage and how much the report indicated that a single mother would have to make $70,000 a year to be not great, but okay, right? Yeah. And so can we talk about that a little bit? Like the people are not getting rich off of SNAP. Like nobody is like, I'm going to really make bank on this food assistance program.
No. So the average SNAP benefit is $6 a day.
Okay.
$6 a day. That's $2 per meal if you're having 3 meals a day. I don't know many people that could do a $2 per meal every day and it be healthy and sustainable for their lives. I just don't. Yeah. We've had colleagues take the SNAP challenge, and I've heard that it's borderline impossible for folks. Yeah. So then when we're talking about $6 per day average benefit, but we're also putting in 30-hour-a-week work requirements. We're also having 1,000,001 hoops to jump through, so much red tape, so much bureaucracy. oh, and now we're going to ban sugary drinks and candy on SNAP. I mean, it's just outrageous, especially for a benefit that, again, is so low. There are so many thresholds that people have to meet to get that. And I think what I'm always struck with on that is, I don't know, I look at a 36-page SNAP application and all of this red tape, and I think that seems like a lot of work.
Yeah.
And yet 200,000 Kansans have jumped through this hoop, jumped through these hoops because they need that $6 a day. They're not just doing it to get their groceries covered. They're doing it because they need access to food and they currently don't have it.
36 pages is the application?
Yeah.
That's insane. What kind of questions are in the application?
Yeah. I think the Social Security number is asked for multiple times, address, everything is asked for multiple times. Additionally, there are questions around if you have a drug felony, and then also if you owe anyone child support. There are a number of questions. One that would exclude you from being able to participate in the program, but also that really catch people. And it's a really big burden for folks to have to walk through. I talk to a lot of Kansas seniors, and I don't know, folks know seniors. I have grandparents. Most folks in Kansas do. And if you're facing a 36-page application when you haven't had to utilize this program before, a lot of seniors are just saying, forget it.
Yeah.
Because then they have to come up with every bank statement, what cars do you have, the whole 9 yards. So it's a very complex problem for a lot of folks.
So the application also includes like an asset accounting?
Yes.
Like you have to go through and say, these are my assets and this is how much money I have in the bank and this is, I have these cars and I have these, like anything that I have, right?
There are some things that aren't really included in that, and I can't get into it's not in my brain today. But yeah, there is asset tests for SNAP, and that is part of the application. So something like if you have more than $2,200-ish in your checking account, you don't qualify for SNAP. It has to be that low.
Yeah.
And going back to me talking about seniors have more in their accounts because they're going to have to make it last for the rest of their life, and they may not be working anymore, right? Yeah. So it's just another way that we punish people for needing access to this program.
Oh, and in the case you've described there with seniors, you punish them for doing the responsible and right thing of saving money over their lifetime to try to make it last a little longer. I think one thing that's always interesting to me, 2 points here. People who have to apply for assistance will often talk about how it's a job. Like you have to go down to the DCF office and you have to do these things, or they want to call you. I've talked to people who are working full time, and if DCF calls you during your workday to get information or to verify your application and you don't answer because you're working, it's a nightmare then after that, right?
Oh, yeah.
Like this is it is also almost impossible to work a job and manage what you have to do to fill out a 36-page application and work with DCF or any of the agencies to get what you need there. Do you find that a lot too, that it just doesn't work well with employment?
I do. As you know, there's in the Kansas State House, there's a more recent committee called the House Welfare Reform Committee, and they brought DCF in front of them basically every year of the last 3 years, but last year they definitely did. And they dug into the research on, okay, well, there's a lot of people who are missing their appointments and, potentially getting kicked off because of that, because over the last few years there have been more and more work requirements, and that means more and more work for DCF to have to validate. And so lawmakers were outraged because the number of people missing their appointments was what they deemed high, right? But advocates weren't allowed to then go up and provide some context, right? DCF really wasn't either, but no one was able to provide this context. People are already working.
Yeah.
And they may have missed that call, or they've maybe missed 3 calls, because if a lot of folks work jobs where you can't just answer the phone whenever you need to, or they're taking care of kids or grandkids or whatever that may be. There are a lot of reasons why someone may not answer the phone right away.
Yeah.
And then as you kind of said, on the flip side of that is then they try to call back, and they wait 2, 3, 4 hours.
Yeah, to get through to someone
on the hotline. So this isn't just an easy process. It's not just Google or call a phone number and talk to someone right away. It's a very complicated process that folks have to navigate.
And intentionally so, right? Like it's been made that way because we put a lot of means testing in it. We put a lot of requirements in. So it's not that it's innately difficult. It's that we've intentionally made it, as a society, made it difficult. The other thing I want to talk about here is food doesn't exist in a vacuum either, right? Like that's just one part of it. So if you need food assistance, you're probably also struggling with transportation. You're probably also struggling with the cost of housing, healthcare. All these things are playing into it. Can we talk about how those things come together and the intersection of that?
Please, yeah. When we talk about SNAP, it just opens up folks' grocery budgets. It doesn't mean that they're not still struggling, right? Or that they're not working or any of the myths. It means that it's opening up a little bit of their budget to be able to have some flexibility to pay for other things. We talk a lot at Kansas Appleseed about what these programs mean to each other and how they coexist. And I love to use the example of, that $6 a day in grocery assistance is that could be what someone then needs to use on rent, right? Or their health care or whatever that may be. So they really do coexist with each other. Do you mind if I kind of jump to federal?
No, absolutely.
For a second? Okay. I think this coexistence is why I'm deeply concerned about what's happening federally potentially tomorrow. There are catastrophic Medicaid cuts and catastrophic SNAP cuts that are on the table, on the chopping block right now. And I see a lot of folks talking just about Medicaid or Medicare. I hear a lot of folks talking just about SNAP or food. And I think we need to really be worried that we are siloing these programs, because cuts over here to Medicaid are the same folks on SNAP and vice versa. So I think we need to be deeply troubled that we're talking about hundreds of billions of dollars being cut from programs that are meant to coexist with each other because it's the same populations.
And one of the things I think, the intent of some of these programs is, and I don't want to get too in the weeds on policy, but they are systems, right? We're trying to create, the intent of these programs when they were created was to establish supportive systems for people so that they could still, it's to support people who need it the most, but it's also a system to support people so they have like a step stool to get to a better place. And is there some worry that if we really make these drastic cuts to some of these programs that we erode that and actually make things worse?
I think absolutely. These programs, like you said, are really meant to help people who are struggling get on their feet. I know I can't speak to any Medicaid or anything like that because I'm not an expert there. But for SNAP, I'll tell you that it really is a program that helps people when they need it. Yeah. Most people aren't on SNAP forever. In fact, you have to be, if you are on SNAP as an able-bodied adult, you have to be working 30 hours a week in Kansas. So that leaves out, parents, but it also leaves out elderly and children, who elderly children make up the majority of SNAP in Kansas. So for the people who need it, it really is a way to get by.
So you mentioned being an able-bodied adult, you have to be working 30 hours. Does that take into account aspects like mental health struggles? Like, say you're not able to work 30 hours a week because you have some form of severe mental health concern. Is that taken into account, or at that point are you just out of luck?
That's a great question, and one that we brought advocates together brought forward to the legislature when these work requirements were coming about. And I will say that it's still a little gray. So our understanding is, and what this committee said was, if you're having mental health struggles to where you can't work, obviously you would not have to, utilize these work requirements. But as we all know, getting disability or going to the doctor for folks and getting diagnosed are additional challenges. So I apologize. That's a bit of a gray area still, but one that continues to cause red flags for me.
So I want to go back 10 years and talk about the HOPE Act, which we think stands for Hope, Opportunity, and Prosperity for Everyone, which is being maybe a little bit liberal with the acronym on this because the view from your side is that it definitely doesn't do any of those things.
We joke that it's the Hopeless Act.
That seems appropriate. So what were some of the provisions that were in the original HOPE Act?
Yeah, so there was a number, dozens of provisions in the HOPE Act, but I'll specifically just talk about SNAP food assistance. Okay. I won't get into TANF and Medicaid for now. So one, I think it's pertinent right now as we talk about immigration in Kansas, but in this country. One, it required the counting of income of non-citizens when determining SNAP benefits. So if there's an undocumented person in a household in Kansas, their income is counted as part of the household, but they are not allowed to receive those benefits.
Okay.
So for a lot of families, a lot of immigrant families, this just had a chilling effect, and they decided not to apply whatsoever. But two, it also, I believe, unfairly and unduly harms immigrant families because that income is counted against them, so their benefits are less while having more people in their household. And I understand that undocumented people can't get SNAP food assistance. However, punishing other people in that household by having lower requirements or maybe not even being able to utilize the program at all.
Because it could put them over the threshold,
That's right.
Right?
It can very easily put families over the threshold.
Yeah.
So I think that's one of the harmful realities of the HOPE Act. Additionally, it prohibits the state from adopting. The USDA has something called broad-based categorical eligibility, and this expands eligibility and assistance by kind of opening up what we were talking about earlier. Families who may qualify for Medicaid likely also qualify for SNAP, so that is prohibited in Kansas. Additionally, it prohibits the use of state and federal funds for promoting the SNAP food assistance program. So
that was an interesting thing that I remember from that you couldn't promote it.
Right. So not everyone knows that they qualify for these, right? I go to a lot of, especially rural areas, where folks think that SNAP is for somebody else, that it's not for them, right? They're working hard and they're having to figure it out. SNAP is for people that aren't them. And that's not the case. And we can't even use state funds to do any promotion of the program, which is really disappointing. Additionally, in the HOPE Act, something that Kansas Appleseed has been working on with bipartisan legislators for a while now to get repealed is in the HOPE Act, it disqualifies people who have more than one drug felony from receiving SNAP food assistance. So after that first drug felony, they could get reinstated on SNAP, but they would have to jump through hoops like drug testing every month, which costs a lot of money.
Yep. Because a state agency is managing that, right?
That's right.
Yeah.
That's right. So when we talk about more phone calls, more appointments, more hoops to jump through, that absolutely goes through this.
And that, I want to make a point, that actually increases the size of government and the cost of government.
That's right.
It's one point I always made. I remember when we talked about, one of the requirements that was added after the HOPE Act was the increasing the age threshold from 49 to 59 for work requirements. And the fiscal note on that was we're going to need a couple of dozen employees and $3 million a year. And I made the argument at the time, this is how government grows. Like we put all these things in and it makes drug testing people and having them go to a state office and do a drug test with state employees cost us more money as taxpayers.
Right. We have we've worked with lawmakers the past several years to bring forward bills to eliminate this requirement. And several years ago, it had to have been 2022, I think, we did a study to see how much is this costing the state, or how much would the state save by just eliminating this requirement, which is a big burden for a lot of people in the state, right? One of my colleagues worked at a food bank for a real long time, and we've had conversations about how a lot of people who would call and need application assistance on SNAP, a lot of the folks who the food bank had to say, you're not eligible, it was because of drug felony.
Yeah.
And that, to me, that gets back to the point I was making earlier about mental health. Mm-hmm. How many people with mental health concerns are self-medicating with some kind of illicit substance that then results in having, drug felonies or any of this that then disqualifies them from SNAP.
Right.
Whereas if we could, use harm reduction, get people assistance they need, that would improve their lives remarkably, get people to the point where maybe they don't need to self-medicate. Maybe they're getting assistance elsewhere through Medicaid, through other options where they're getting the help they actually need that right now we're just not providing.
And in some ways, this excludes an entire group of people from the economy.
Right.
I mean, it just says you don't go figure it out. And I think we now know having a drug felony is people, I think more healthy conversations today about recovery and the prospect of recovery if we can support people in their recovery. And one way to do that, of course, is to create some stability in their life. Mm-hmm. And food is definitely a part of a stable existence that allows you to get to a better place.
I completely agree. And going back to both of your questions, the intersect between financial prosperity and mental health is something that's very important to me. And addiction, I think it kind of all goes together. We don't talk about it enough. I lost my uncle to suicide several years ago. And I'll tell you what drove it was not having enough resources. Mm-hmm. Money is a huge stressor in people's lives, and we don't talk about it enough. Of course, people have more mental health struggles or anxiety, depression, whatever that may be, if they are trying to navigate life without having enough resources to get by for themselves and their families.
That is such an important point. And I think going back to what you said earlier about, SNAP is one part that just frees up a little bit in one place. But people who don't have enough to navigate life, there are health effects with this, there are mental effects with this, people can get into kind of a spiral, and it's just, I don't know that we fully acknowledge, like you said, the adverse effects of not actually dealing with people not having enough resources to live well. Not even well, just okay.
Just to live.
Yeah, just to live.
And I think that goes back to when we were talking about myths earlier and how myths in the 60s are still pervasive in 2025. Constantly I hear about pulling yourself by the bootstrap, or folks just need to get out and get a job. Folks, it's this or it's that. And it's just not true. How hard do we want people to work? I mean, folks are working hard and ends are still not being met. That goes into a whole different conversation I don't think we want to get into today. But it's a reality that a lot of Americans are facing. And so then when you throw in national issues like tariffs or taxes or eliminating or cutting SNAP and Medicaid, of course that contributes to people's anxiety around money. So
this myth thing really gets me. I want to talk about that a little bit more. I know they keep coming back to it. There's a lot of talk in SNAP about fraud. That there's just fraud is running rampant. There's all this stuff in there. There's always talk about auditing the program. I think there was some legislation this year about making it easier to do audits on fraud. What is there rampant fraud in SNAP? What do we see here?
I work with this program every day, and if there's rampant fraud, I'm not catching it. I'm not seeing it. But first of all, SNAP fraud is very low. I think it's less than 1%. It actually is less than 1% of the entire program's budget. Very, very small. The Kansas legislature has talked a lot about fraud and brought in what they deem as experts. They've brought in DCF's fraud team, and they continue to talk about these big stings that happened years ago. One or two that maybe were a lot, but long time ago. I think the other reality that we need to talk about is that less than 1% of program budget in SNAP fraud is just hardly ever actual participants. Mm-hmm. More often, we see skimming. Skimming is a huge issue. People are using skimming devices to catch EBT card numbers and then take that, and that's not the participants that are contributing to that. That is taking away from the SNAP participants.
Yeah.
Because these it's seriously criminal fraud rings who are skimming and taking families' money away from them. But then the state and federal government won't replenish those benefits. So families who are skimmed are then out, their allotment for that month. So fraud, this question of SNAP fraud is something that's very frustrating to me, because in the news, in the legislature, all over, we hear about SNAP fraud. But the reality is that participants for the most part, are not participating in fraud.
Yeah.
Fraud is happening to them.
Okay. And that's what I remember seeing, is that it's not on the consumer end of things, it's on the other side of things. I want to do something. As you were talking about that, it made me think. I would like to run through a series of things I hear about SNAP and then have you answer them. And I'm going to frame them just as if, I'm going to frame them in the same way that I hear them, and then ask you to respond to them. Okay? I see people with food stamps getting steak, and I can't afford that.
Well, they can get steak, but a lot of families are not going to get steak because it's more of the expensive options.
I see people using their food stamps for nothing but junk food.
Well, after this, currently the state is putting together a waiver that would ban sugary drinks and candy from being able to be purchased on SNAP. However, in a lot of places, what some may deem junk food is actually all somebody can buy. I think of a lot of places here in Kansas. I drive all over, as I know you do as well. How many Family Dollars and Dollar Generals do you see in these rural towns with no real grocery store? Mm-hmm. And you go in to get a water or Gatorade or something, and all I see is stuff that others would deem junk food. But what I know is that a lot of this community, this is what they have to rely on.
Yeah.
Because the closest grocery store is 30, 40, 50 miles away.
We have a lot of food deserts in Kansas, and we don't always talk about that. But yeah, and the Dollar Generals fill a need in some of those, but they don't fill it necessarily well.
Yeah.
Because they're highly processed food.
Well, and food deserts exist all over Kansas, anywhere from the smallest, ruralest part of Kansas to the urban center, Wichita. I'm from Wichita, and goodness, we've been talking about our food desert for years and years, and still it feels like nothing has been done. I feel very privileged. If I am sitting in my driveway and I look around, I can name 7 grocery stores within maybe a 2 square mile radius. But if you go 5 miles west of me, there are no grocery stores for miles and miles.
Yeah.
And what do folks do when they don't have access?
Yeah. Let me think of another one that I've heard before. We taxpayers are letting people buy junk food, and then we're probably also paying for their bad health. That's one of the arguments behind the ban on sugary drinks and snacks, right? Like they basically, the argument was, well, we're letting them buy unhealthy food, and then we're paying for their bad health care too.
Can I ask, are you hearing these from the same people that are saying they're at the same time saying, I see them buying steak and that makes me angry. And then also turning around and saying, so they're saying they're buying the expensive good food and that makes me angry. They're buying the cheap bad food and that also makes me angry.
Yeah, it's generally the same crowd of people.
Okay.
Well, and
just checking.
The same crowd saying, I just have to tell, can I just...
Like an off-the-record thing?
It doesn't have to be.
Okay.
Several years ago, I was in a congressional office, and I was talking to a staffer, and I'm not going to assume that this staffer was really in on food work. I think he did something else, but that's who they put me with to have the meeting with that day. And I was there talking about SNAP, and he looked me dead in his eyes and said, well, I see a whole bunch of people here in D.C. who are using their EBT cards to buy alcohol and cigarettes. And I said, well, first of all, what do you do when you're in a congressional office and someone says that? Because, I want to be respectful. However, I shared that, you can't buy cigarettes and alcohol using a SNAP card, which, kind of turned into an argument per se that I did not want any part of.
Yeah.
But I think the reality, I think what you're trying to say here is there are a lot of bogus arguments around SNAP.
Yeah.
And the unfortunate reality is that people believe them and don't look into what the actual program requirements are, what actually people are facing before they just say X, Y, and Z about the program. And it's a shame because, one, I wish that people just understood this program more. 200,000 Kansans are on this program, millions of Americans. A lot of our neighbors, us, families utilize it. So we need to understand it better. Unfortunately, as you talked about earlier, the program has become so much red tape and bureaucracy that it's impossible. I mean, I have a hard time even remembering every single policy on this program. How could we expect someone who needs the program or someone who's just curious about what the program does understand every rule and regulation around it?
Mm-hmm. And I think it's important to note, too, tell me if I'm wrong on this, SNAP is a federally funded program, and the only obligation Kansas has is in the administering of the program. So when Kansas does things like the HOPE Act, and as it relates to SNAP, and we put in additional requirements year after year after year, what we're doing is foregoing federal money coming into our state for people, and we are increasing the state level cost because in our creating barriers to SNAP, we are forced to employ people. We're expanding the size of the application. We're doing drug testing. All of these things cost Kansas taxpayer money when it's only more restrictive than the federal government requires. We wouldn't have to do anything and it would be cheaper for Kansas.
You're exactly right. And it is a shame because Kansas has some of the most restrictive requirements on SNAP in the nation. How do we continue to do this? Of course, we're leaving money on the table. Two, we are creating more undue hunger and hardship across the state. And that's not who our state is. And that's why I do this work, because I'm a fifth generation Kansan and I'm proudly from here and want to stay here forever. That's not who we are. Senator Bob Dole, Senator Pat Roberts, some of our Kansas forefathers fought to make sure that no one went hungry in the heartland. And now we are facing poverty and hunger on the rise in Kansas. So it's just a very interesting, it just really is interesting because we talk out of both sides of our mouths in Kansas. We say that we care about our farmers, and our farmers are hardworking, and they're the hardest working people in America, and I believe that. But we hear this from lawmakers that we've got to protect our farmers. Our farmers need SNAP too, and they're telling us that. Yeah. Farmers don't want SNAP cuts. So I think it's just a big shame, but I continue to see Kansans and Kansas lawmakers kind of talk out of both sides.
This is an interesting point, and I think you kind of alluded to it earlier when you talked about the conversation with one of your colleagues and a lawmaker having this emotional moment about, having food insecurity. In my experience, the way people in Kansas look at issues like hunger individually, very compassionate. Kansas is the kind of place where in every small town, if somebody's struggling, they'll put together a casserole and take it over to them. Whether it's a death in the family, a sick kid, whatever it is, a bunch of people mobilize and they're like, and we know we're the breadbasket of the country, so our instinct is food. Food makes things better, right? Somehow that gets warped. Like, it's the way I see people individually respond to hunger and the way we talk about it at a policy level, completely different. Do you have any thoughts or insight on what that disconnect is?
I think I'd maybe thought about this, but not put two and two together like you just had, and I see that all the time. Even in my family, if folks are struggling or need SNAP, family members will mobilize and help and do whatever they need. But then if you hear this story about another family, in another town over who is facing the same things, some people's brain just goes to the conclusion that they're not working hard enough, or there is a reason that they are facing hardship that may be a personal reason, or they don't just have their act together, not a systemic reason, right?
Yeah.
So I see that all the time, both in my own family, but also as I'm talking to Kansans, to lawmakers, and to others.
It's really interesting to think that, there is a concept that I think groups like Appleseed are trying to work through, is the idea that poverty is a moral failing or an individual failing and not a system problem. I've always viewed poverty as a systemic issue, that we have systems that don't catch people in all the circumstances, and a lot of people don't thrive in a system that doesn't account for differences in mental health, physical ability, any of these things. But it just feels like that narrative out there that somehow poverty is a moral, personal failing. I don't know if I have a question in that. It's just an odd thing to me that's the world we live in.
And I think that idea around poverty being a moral failing then seeps into our everyday views, right? Or just our country's culture around needing help and needing assistance. I see too often people who are doing everything possible to provide for themselves and their families, and they still even feel themselves like it's a moral failing. And I just fundamentally don't believe it is. We just spent probably, 30, 45 minutes talking about, honestly, in the grand scheme of things, a very small set of barriers as it relates to the broader food system, the broader safety net system. We talked about just this piece over here with SNAP. How many others have we put in on Medicaid, on TANF, on school meals, right? Whatever it may be, we've put up a ton of barriers.
Well, they always say it's expensive to be poor.
That's right.
It's really expensive to be poor. People don't understand that. I could go into all the details on that, but people do not understand, unless they have some direct exposure to it, they do not understand how expensive it is to be poor, because there's so much you can't afford.
And you're always behind,
always.
Right? So, this paycheck goes to rent, mostly to rent. This one, I'm behind on my utilities, so I really got to pay that by the 13th, or I'm going to go in collections, or they're going to shut my electricity off. There's always, when you're poor, there's always something that you have to pay for. You get a little money back in taxes, maybe. Well, that goes to whatever you didn't get done the months prior that was a big expense, whether that's car tags or whatever it may be. It's just, as you said, it is very expensive to be poor. Yeah.
And I just think it's getting more expensive. The inflationary environment we've been in, everybody talks about the cost of groceries, but I had a question about this. We know that we've seen substantial inflation in groceries, not the part of which is due to when I think there's some reporting on, price fixing, things like that. Have we seen an increase in SNAP benefits due to the inflation? Are they adjusted for that?
There is a little bit of an adjustment. I would say nowhere near the amount of inflation that we've experienced.
So the SNAP benefits are not at all keeping up with the inflation that we've currently experienced.
SNAP allotments are decided by something called, and I apologize, I'm getting in the weeds.
No, this is good.
They are decided by something called the Thrifty Food Plan. And the Thrifty Food Plan just kind of calculates, okay, what would this grocery basket look like by basically the bare minimum. Mm-hmm. And this was decided a long time ago, like over 30 or 40 years ago now. And this same Thrifty Food Plan is what we're still utilizing on SNAP. So when we talk about what people are buying on SNAP, their allotments are what the federal government deems as needing to be the thriftiest of thrifty to be able to get by. And I'll tell you, it is not a lot.
No. And you made a point about how that hasn't been adjusted for a long time, which makes me think about the federal poverty level and how that also hasn't been accurately adjusted. What is the federal poverty level right now for a family of four is, what is it, $30-something thousand? I mean, but the federal poverty level is really low.
Very low.
And it hasn't been adjusted since
a long time.
Yeah, as you said, at least 30 years or so.
Yeah.
And so what is how are the qualifications? How is someone, what's the income threshold or what are the sort of qualifications for SNAP? Where's the, I know it's a little bit fluid based on income and everything, but what's the general income threshold?
So there's a lot of factors that go into being able to qualify for SNAP, like household size, assets, as we talked about earlier. But generally, households have to have a gross income at or below 130% of the federal guideline.
Okay.
We are not talking about a lot of money.
No. That's a very low amount. And as we talked about, the federal poverty level has not been adjusted.
Right.
I think in Reno County, Kansas, the MIT living wage calculator has us at about $21, $22 an hour as a living wage. So that 130% is well below that. Mm-hmm. And I know that most of the jobs here are not paying anywhere near the average wage in Reno County is below the living wage. And when you exclude high-income jobs like doctors and executives, you find that the average wage in Reno County is much, much lower, more like $12 to $13 an hour. So that's one of the things that when you really start to dig into the statistics and look at this, you see that the income thresholds are we say, this is the threshold, but there's a lot of context that's missing from that. Mm-hmm. Tell me about the work you all have been doing over the last several years. You've really been active in this, and frankly, you're playing defense a lot. It's unfortunate because, from my perspective, it seems like going in and saying we would like people not to starve is a pretty winning argument. Most people are yes, we agree with this. But you find yourself playing a lot of defense, trying to preserve existing programs or to keep them from being further complicated. Can you talk about that experience a little bit?
Yeah, I can. I've thought about this a lot because it's my life. But advocates for SNAP are typically never getting to play quarterback in Kansas. I wish that we're on the other side and we're safeties. We are kind of a last ditch, doing everything we can to stop really bad SNAP policies from going through, mostly at the state level, but we've seen a lot of onslaught of attacks at the federal level in recent years, especially as well. Of course, I do a lot of work with the Kansas legislature, and I am always so energized before legislative session because I want to put together some good bills that may increase access to SNAP, or honestly, at least just decrease harm
Yeah.
for SNAP. However, around about the third week of legislative session, my heart sinks to my feet, and I typically know that we're going to see a lot of bills that we're going to have to play defense on. What's so unfortunate to me, and I think something that I lose sleep at night a lot on, is a lot of these bills that harm SNAP are being brought forward by think tanks that aren't even Kansas think tanks. They're based in Florida. So we're not even thinking about Kansas solutions to Kansas problems.
Yeah.
And I'm not going to sit here and say that there aren't problems with SNAP. The problems are not the participants. The problems are the bureaucracy or the call wait times or, how long it's taking for SNAP applications to process. But there are very real issues that we need to address with the program. And we cannot, because the Kansas legislature follows the lead of these think tanks from other states who bring ideas forward that are often, if you look at the bills that they bring forward, they're typically rushed, they make no sense, and they take a lot of time with the reviser because, they were made for another state half the time, right?
Yeah.
So I think that's what the biggest shame is for me, and is a lot of my time during session is fighting these bills, not even brought forward by Kansans.
That was always a frustration of mine, the Florida groups, and I frankly think that if you're going to model after another state, Florida is the worst place to do it. A state that is like the running joke is you could write any headline with Florida man ... is like I don't know why that's the state we want to be like. It doesn't make any sense to me, but that Opportunity Solutions Project is the group that I remember coming out of Florida. It never made any sense to me why they were here. I was always perplexed. They had a management team that made. I looked up their 990 form, and they made upwards of $250,000 a year for their top executives, and they're flying them to Kansas. And I never understood what their motivation is. Feels like they would have plenty of opportunities to solve problems in Florida instead of messing around with Kansas. But I think it is really important for people to know that the erosion to programs like SNAP these are not homegrown. The people that are attacking this are not homegrown people. These are coming from out-of-state, nationally funded groups that are trying to erode this program on a much bigger scale. It's not that somebody noticed a big problem in Kansas and said, we have to take care of this. And also there's just and it plays into a broader narrative. And I just I'm glad you brought that up because that is really important for people to know, I think.
Well, the other I agree. I wish that more people understood that while I think we all wish that lawmakers were coming up with their own solutions with their community, right? Mm-hmm. Sometimes that's not the case.
Yeah.
And that has not been the case when we talk about SNAP, food assistance policy, and especially in the last 10 years, which I think is why we really wanted to lean in on this report. The other thing I want to share on this is this group, Opportunity Solutions Project, has seen Kansas as what they deem kind of a shining example of success, because we do have some of the most restrictive policies in the country. And they've taken this Kansas show on the road. And I think that's what's most scary to me. So what I deem is definitely not working in Kansas that they've put up as policies are now kind of going into other states and using Kansas as an example. And that's disappointing because Kansas should not be an example on SNAP policy at the moment, because we have really done a disservice to those who need access to the program.
Well, are we near the bottom on access, right? There was something in the report that we're 48th or something.
Yeah, we're 48th or 49th in SNAP it's an accessibility index utilized by the USDA, which means people who need we are 48th or 49th in people who need the program not being able to access it. And that's shameful.
The other thing I think is stands out to me, or something that stood out to me in the report, is that, again, the SNAP and the food assistance doesn't exist in a vacuum. Everything is together. And one thing that I read in the report that I found interesting was that if families are dealing with food insecurity and they can't access SNAP, one thing that Opportunity Solutions Project touts when they go to other states is about how there's been this big reduction in the people accessing SNAP, other benefits in the state. But what they don't talk about is that has created a lot more instability in at-risk families. And what we've seen over the years since the HOPE Act, if I read the report right, is an increase in the number of families entering foster care because, and then I remember at the time I was at the news and we were writing about this, but there was a real deep concern that as you destabilized already marginal families, that are just on the margins, that financial strain, increasing that financial strain, actually, now I'm really remembering it, led to increases in domestic violence. It led to increases in divorce and separation. All of this undermined what we actually want, which is financial stability for families. And I wish that was a bigger part of the conversation that we had.
Yeah, you're exactly right. I know Dr. Donna Ginther has done a ton of research on this. She's amazing, and I'd encourage everyone to check out her work. But after the HOPE Act, we saw participation in safety net programs plummet and foster care cases skyrocket. Yeah. So we really did see this horrible dichotomy. And it's as clear as day to me why that was. And ultimately, it's because we are punishing people for poverty. So,
as you'll get ready for, you got the summer. You guys will spend the time doing more research and doing more preparation, and you'll get excited for legislative session again. Maybe we'll talk a little bit about, I guess, maybe what you'll want to do in this time between sessions. And also, maybe if you just could sum up what you wish people really understood. If they've had no experience with SNAP, no experience with food insecurity, based on your work and what you've seen and the policy area that you work in, what sort of things do you wish people really understood about SNAP and about the families who need it?
Yeah, I think that's a great question. And it kind of goes together for me because honestly, for Kansas Appleseed and definitely for me, preparing for the next legislative session starts the day after Sine Die for this year. So we've already kind of thought through what our plans are going to, not really thought through, but really we've been exploring and thinking about what it looks like, what next year might hold. I know for my spring and summer, I want to connect with as many legislators as possible. And so I'm hoping to travel the state and talk to folks, especially newer legislators. I've really been trying to talk with them and hear from me about what SNAP means for Kansas families and what opportunities we have on SNAP. Because, like I said earlier, we do play a lot of defense. That's 90% of my job during session. But there are always things that we can agree on. I fundamentally believe that we can get things done in the Kansas legislature. I don't know how. I don't know what the policy is going to be. But I do believe that we can find some bipartisan ways forward on SNAP that would eliminate some barriers for Kansans. There's a lot going on in the legislature around government efficiency. And so I think that there are a lot of ways that we can make SNAP more efficient, starting with a 36-page application and moving from there. However, the bills brought forward this year from the Government Efficiency Committee, I didn't deem as being any more efficient for our government around this program. So I'll be spending a lot of time working with lawmakers and talking to them about SNAP and even seeing what they feel would be in the best interest of their communities on SNAP. Because I know that, you worked there for years. I know, I have to believe that legislators do understand that poverty exists in Kansas, that there are food deserts across the state, that their communities are struggling, and there are ways that we can help them. And so maybe I'm naive, maybe I have a lot of wishful thinking, but I just really believe that we can get it done.
I think you're right. I think it's a matter of just, continuing to do the work you do to make sure you're educating people and bringing, the reality to light about what what families are dealing with in the state. So I'm really glad you're doing that work and that you're working tirelessly from session to session to make sure that you're gathering these stories and making these contacts and doing this work. If people are interested in learning more, like if they want to read this report, are some of these resources available at Appleseed?
Yeah. So all of our reports, our blogs, even legislative testimony on these bills will all be on our website. It's just kansasappleseed.org. Additionally, there are, if folks want to get involved in anti-hunger efforts, whether that's testifying in front of some of these committees we've talked about today, or other ways, we'd love to have you join us. We have something called the Hunger Action Team, and that's a group of about 3,000 Kansans who regularly take action. So we'll, if there's something federal going on, we'll send out an action alert and they'll take action on that. You can also find information about that on our website. And then the last thing I would share is we didn't talk about school meals today, but we're getting really deeply invested in ensuring that school meals, Kansas kids can access school meals in a better way than what's currently happening now. And so we've got a lot of things cooking there that we'd love to have folks' involvement in, because what we know is that, like we talked about today, all these programs go together, and kids on free and reduced price meals in Kansas are often also on Medicaid or SNAP.
And you and I have talked about this a little bit. There's a way to make the school lunch system a lot better for not a lot of investment.
There's a way, and we got halfway close this year.
Yeah. Yeah. Well, I might have you come back on and talk about that before the school year starts, because I think that is a really important policy that you're working on, and one that could fundamentally change the way we think about school lunch and school nutrition programs. So thank you for coming in today. Thank you for sharing so much information. And I look forward to having you on again to talk about this issue more. And thank you, Haley.
Thank you, Jason.
I'd like to thank a few of the people who've helped make That Podcast in Hutch possible. My son Mitchell Probst wrote and recorded the music for the show. Jenny Brigette put together some great graphics and promotional art. And Chris Acker helps overcome my mistakes to produce a great sounding product every episode. That Podcast in Hutch is made possible through a collaboration between the Hutchison Arts and Culture Collective and Salt City Sound. They're working to bring resources and infrastructure to support art, music, and storytelling in our community. If you have an idea for your own podcast, reach out to them at podcasts@saltcitysound.net. If you enjoy That Podcast in Hutch, be sure to subscribe and share it with all your friends. You can also help support this production by subscribing to thatguyinhutch.substack.com or by emailing me at thatguyinhutch@gmail.com to learn about sponsorship opportunities. Thanks for listening, and I hope you'll join us again next week.
A Salt City Sound production.